How can one avoid and treat pigmentation?
Pigmentation is the most common problem, especially for us Indians, because of our skin color, the skin type, and the sun exposure that we end up having. One most important thing that you must do, as I go on and on saying, is sunscreen. Regular, very methodical application, repeated application of sunscreen pretty much avoids the pigmentation. Also, one more thing that contributes to pigmentation is our female hormone itself. So there could be various times when probably you are pregnant, or there's a menopausal period, or you kind of overdo your hormonal pill. You could end up getting these pigmentations, which can be avoided if it is about the oral supplements that you have taken, but there are times that you can't avoid it. Those kind of pigmentations, which generally we call melasma, is very, very difficult to treat. The other kind of pigmentation, there are a whole lot of things that you can do. There are bleaching and skin lightening products that you can use as home care. There are skin lightening oral medication, which is like the vitamin C, which is most common. And then you could end up doing some office procedures like peels, like microdermabrasion. One of the most effective for pigmentation, of course, is the Q-switched Nd:YAG, the Medlight, which is a fantastic equipment for your pigmentation, your dull skin, your tired skin, whether it is on your face or it is on your elbows, arms, feet, underarms. Any part of pigmentation can be beautifully taken care of with this laser.
How does one treat on dark circles and sunken eyes?
Dark circle and sunken eyes could coexist at times or exist on themselves separately. When there is dark circles, it could be a hereditary one, in which case you have darkness right on top of your eye and the below portion of your eyelid. It could just be stress which is causing it look really dark and tired. It could also be sometimes that when you rub your eyes, some people have this habit of really rubbing their eyes, then the small blood vessels rupture and the blood leaks out underneath, and the pigment that leaves behind itself could cause your dark circles. The other ones could be because of stress, because of long hours of computer, television watching, reading, where probably your adjustment of your eye lens is not right, so you may need to visit your ophthalmologist. It could be nutritional reasons, like just less in your hemoglobin percentage or your ferritin percentage could also cause under eye dark circles. So please go ahead and do your necessary blood test to rule that out. A very little common problem could also be because you don't remove your eye makeup meticulously well, because makeup eventually ends to seep in and leave the dark mark. That could just be that. How we go about treating it? You could do a little procedures at home, like the skin lightening ointments, lotions and potions which are regularly used. A good sunscreen, take care of your health, get your nutrition supplements right, and then there are specialized peels which can do wonders for your skin under your eye. There are lasers like Medlight which can take care of that. And sunken eye itself can give rise to dark eye because of the shadow of your sunken eye as well as shadow of your brow. Sometimes you'll be amazed if you change the lighting of your room, it's not a top lighting and a front lighting, immediately your dark circles are gone, in which case you don't need a doctor. But when there are sunken eyes underneath, it takes 2 minutes to do a small little filler injection here to take away that sunken look, and you look fresh and well rested as ever. What I'm going to do now is a Q-switched Nd:YAG laser. We have the C6 Medlight, which is one of the latest. And this emits light or laser light, which will just hit on her skin, will not cause much of a pain, but causes a momentary heat, and that's it. This laser pretty much does good for any kind of pigmentation. Right from tattoo to your tan, it gives you an amazing result for most things. What we are doing for her is for her pigmentation problem that she has on her cheek. May not give you a great result with melasma, but definitely reduces it and reduces the tan and the other uneven pigment on her skin. There is no downtime in this procedure. Aftercare as usual is just a bit of a sun protection, and that's it. This is also used as a hair reduction laser. It also permanently bleaches the fine hair on your face.
Thanks to Dr. Shetty and her team for returning back my freshness. I was always bothered about my pigmentation, did try creams and peel, everything anybody had to say. Now at Dr. Shetty's, I'm doing the Q-Switch NDAG laser, which has done wonders in reducing my pigmentation. Along with it, I see the fine hair on my face has reduced a great deal. And my god, I was bothered about side effects, and here I have one for which I'm so thankful for. My skin looks a lot tighter and lighter than before. Thanks to Dr. Shetty and her team for returning back my freshness.
The Medlight's long wavelength, short pulse duration, and high peak power combine to optimally destroy dark chromophores with a very low risk of permanent tissue damage.
How does one treat on dark circles and sunken eyes?
Dark circle and sunken eyes could coexist at times or exist on themselves separately. When there is dark circles, it could be a hereditary one, in which case you have darkness right on top of your eye and the below portion of your eyelid. It could just be stress which is causing it look really dark and tired. It could also be sometimes that when you rub your eyes, some people have this habit of really rubbing their eyes, then the small blood vessels rupture and the blood leaks out underneath, and the pigment that leaves behind itself could cause your dark circles. The other ones could be because of stress, because of long hours of computer, television watching, reading, where probably your adjustment of your eye lens is not right, so you may need to visit your ophthalmologist. It could be nutritional reasons like just less in your hemoglobin percentage or your ferritin percentage could also cause under eye dark circles. So please go ahead and do your necessary blood test to rule that out. A very little common problem could also be because you don't remove your eye makeup meticulously well, because makeup eventually ends to seep in and leave the dark mark. That could just be that. How we go about treating it? You could do a little procedures at home like the skin lightening ointments, lotions and potions which are regularly used. A good sunscreen, take care of your health, get your nutrition supplements right, and then there are specialized peels which can do wonders for your skin under your eye. There are lasers like Medlight which can take care of that. And sunken eye itself can give rise to dark eye because of the shadow of your sunken eye as well as shadow of your brow. Sometimes you'll be amazed if you change the lighting of your room, it's not a top lighting and a front lighting, immediately your dark circles are gone, in which case you don't need a doctor. But when there are sunken eyes underneath, it takes 2 minutes to do a small little filler injection here to take away that sunken look, and you look fresh and well rested as ever.
Doctor, how does one take care of tired eyes and dull skin?
Dull skin is due to accumulation of dead skin cells which get accumulated and don't kind of get shed off very easily. Along with the dead skin layer, you also have clumped melanin or your pigment cells that come along with it. So in all together you look dull, probably a couple of shades even darker than what you were earlier. So the first thing that you need to do is a good exfoliation. You could either do a mechanical exfoliation or a chemical exfoliation. A mechanical exfoliation is using scrubs at home. Make sure while you choose your scrub that the granules are really small, tiny and skin friendly and easy on your skin. Or you could just do a few home care mantras like use some lemon and cream. That itself helps ease out the dead layer from top and fall off. Or you could go to your doctor to a microdermabrasion. Or there is chemical exfoliant wherein we use certain chemical ingredients like AHAs, glycolic acid, lactic acid, which soften the dead skin, the cement between the dead skins, make it easy to come off. Now, one wonderful procedure which you could do is use a laser called MedLight. It's a Q-switched Nd:YAG laser which just scatters the pigment away from underneath the skin. So it helps when you have deeper issues which cause dullness of your skin. So therefore, dullness, tiredness, they all kind of go hand in hand. And then you could resort to a few injections like just about pumping your under eye and taking away that sunken eye. Therefore, then you start looking a lot fresher and correcting a little here and there to just tweak it up to make it more fresher and even toned.
How can one enhance and glamorize their looks?
Yes, all of us are not born with the perfect looks. You look almost perfect. But the others who are not as lucky as you, yes, there's a lot can be done. We could shape that bridge of the nose, which used to be surgery, and then depend on your luck, is the surgery turning out well or not, and there used to be a lot of downtime. Now you don't have to do that. A small little filler procedure here gives you a fantastic nose. And then you could, of course, have your nice long eyelashes. There's a product called Latisse which is available for you to apply. You could have a fuller, nicer, sensual lips. All it requires is a bit of a filler. So yes, there is a lot of scope now to look better and better and better.
The MedLight's long wavelength, short pulse duration, and high peak power combine to optimally destroy dark chromophores with a very low risk of permanent tissue damage.
There are a lot of times that people come to us saying that there's a really heavy jaw or we have a broad lower face. But there are a lot of times people also come and say, Doc, when I take a long photograph or a full length photograph, I look fine. But when you take a mug shot, I seem to look like I have a huge body below me, though I look slim. That's only because your face looks really fat. It could be the fat component, it could be the muscular component. If it is the muscular component, then this kind of injection, when we give a little bit of Botox along your masseters, works wonderful. It just tapers your face within a month's time, and then everybody starts asking you, wow, have you lost weight? And that's all. Nobody really makes out that you've done something.
I always felt conscious about my jawline. It was very broad and sharp, and as a musician and someone who needs to be in the public eye, I always felt like I needed to cover it up. Directors while shooting on sets and photographers on photo shoots always asked me to cover up my jawline with hair. I knew that there were medical procedures to improve my jaw, but I was always worried about what the effects would be. But I don't worry about my jawline being too overpowering anymore, and that's all thanks to Dr. Rashmi Shetty and her team. She introduced me to this pain-free procedure and recognized that I was a good candidate for it. Her aesthetic eye meant that she gave me the desired cut on my jaw, not too less and not too much. This has allowed my jawline to become more oval and keep symmetry in my face. The results have been brilliant, and now I can experiment with different hairstyles, and I don't need as much makeup or contouring to cover up and shade my jawline.
What we are now going to do is Botox for a heavy jaw or a hypertrophic masseter. This is one of the muscles among 4 other muscles that you would use to chew. This was more used when we had to chew the raw meat or to tear the meat. So right now it's not that it is so necessary for us, but there are some people who really have it hypertrophied or bulkier right from the beginning. There are some who have this condition all along, but there are some who develop it because somebody told you chewing gum makes your facial muscles better. That is not true. All it makes is this bigger. We all want a nice tapering lower half of your face, or then a very well chiseled square jaw, but not something which is bulging slightly. We are going to just make this a little softer to suit her face. Her chin is a little narrow, therefore I'm not going to cut this off completely because that may not look good that much. I'm just going to ease this off to then suit the rest of her face. I'm going to do a little simple marking which is going to make my injections easier. Just clench. Okay, this is the anterior border of my muscle. This is the angle of my muscle. Alright, this is the most prominent of her space. See, this is how it is. As soon as the injection, you won't see anything. Absolutely nothing at all. The only post-care injection would be that I would ask my client to keep biting for the next 1 or 2 hours so that the muscle action keeps on, and that's about it. If at all, you may face a little headache the next morning, and that's because of your chewing and not because of the injection. The action goes on to take place slowly and slowly. In the next 15 days, she will have comments of people saying, wow, you've lost some weight. Thereafter, in 1 month, it really achieves the maximum result it has to achieve. And then you decide whether you want to top it up a little more and just let it be. And after 5 months, you redo it. Then the result lasts pretty much for a year after that.
I've always believed that it's great to feel confident and be happy with what you have. But there's no harm with a little help on the way. My help was Dr. Shetty and her team and her treatment. So thank you all once again.
Hyperhidrosis can be just a small irritation with a little excessive sweating that could stain your most favorite designer clothes, or could be a huge social embarrassment where even shaking hands can be a huge embarrassment to a person. So hyperhidrosis, whether it is underarms, palms, your soles, can now be treated without the earlier solution which led to compensatory hyperhidrosis elsewhere. Botox is a very, very simple solution, literally a 1-minute procedure which gives you freedom from this excessive sweating from 4 months to almost a year. So let's now see how simple the whole procedure is and also painless. What we are doing now is raising small blebs between his skin with Botox. If you see, there's hardly any bleeding, or rather no bleeding, and these tiny blebs disappear in the next 10 minutes. No downtime, no compensatory hyperhidrosis anywhere. He is sweat-free for the next 4 months to almost a year. Some of us, we are born with beautiful shape of lip, beautiful size also. But as we grow older, lip starts becoming thinner and the lines start becoming more evident. All we have to do is just plump it up a bit and you look so fresh and happy. Not necessarily all of us need to have a pouty lip, but a fresh lip has always made all of us look a lot fresher, younger and happier. For the ones who don't have a good shape, we could create a good shape, give a good pout. Yes, is it possible to create Angelina Jolie lip? Maybe yes, if you walk in with Brad Pitt. We are now going to anesthetize her lip, which is a little different from the rest of the procedure. Just relax your mouth, please. Relax your mouth. I'm going to just spray something. Do not swallow it. You won't know the pain. Poonam, you won't know the pain at all. Finished. I'm going in. You will not know the pain. Slight irritation. Very good. I'm going to give you a small injection in the corner of your mouth.